The news that hotel quarantine staff in Perth may not have been required to wear masks, even when delivering medicine to residents in the hotels with COVID, shows just how slow different states have been learning the right lessons to deal with this virus. Victoria did not learn the lessons of Sydney's Ruby Princess disaster, and now it's patently obvious that Western Australia did not learn the lessons of the hotel quarantine debacle in Melbourne and the second wave it caused. Apart from fronting media conferences to issue instructions to the public, what have the state's chief health officers been doing, if not looking at what's gone wrong elsewhere and making sure it didn't happen in their state on their watch? And apart from playing the politics of this pandemic for all it's worth, what have the premiers been doing, if not learning the lessons of mistakes elsewhere? And apart from standing there at the back of the press conference every day, nodding away, surely a few state health ministers deserve the sack for letting yet another hotel quarantine failure happen, when by now, surely we'd have the systems right. Almost 12 months into this pandemic, and with 2 state-based inquiries already, it's bizarre that hotel quarantine staff in Perth were not required to wear PPE when dealing with returning travellers, were allowed to have second jobs dealing with the public, and were not tested daily for COVID until late last week, despite all the other states doing so for some time. But as we've learnt from Victoria, premiers are now so invested in their COVID tough guy personas that no state-based inquiry can be trusted to uncover the truth about what went wrong and why. And what Perth has shown clearly is that no public servant interstate clearly bothers to read any of these reports or implement recommendations. The Victorian government spent $5 million on the Coate inquiry, and then another $7 million, $7 million plus, on pricey QCs and legal teams for the Premier, ministers and all the senior public servants. $7 million just to say, I don't know and I can't remember. It's an absolute farce. And if there's one thing people still stop me in the street to raise, it's this. Where is the Federal Royal Commission we should have, that we need to learn the lessons of this pandemic, to get to the truth, to properly understand what went right, what went wrong, all up with our COVID response as a nation? Because there is no doubt this won't be our last event like this. Most assuredly, another pandemic will come, whether it's in 1 year, 1 decade or another century. Given that the pandemic has changed every Australian's life, it's killed over 900 people and loaded all of us with at least an extra $300 billion in debt-funded spending at a federal level alone, it would be odd, to say the least, not to have a strong national inquiry. We had a National Royal Commission into last summer's bushfires, which only impacted the eastern seaboard and had relatively minimal economic impact. So why wouldn't there be a national inquiry into the biggest crisis we've faced as a nation since the Second World War? Nothing is bigger than this pandemic in terms of budget hit, loss of life, economic disruption, internal chaos since the Second World War. There's nothing bigger than this. The governments have an inquiry to tell them what the time is. Yet no inquiry into this virus and our response, the good, the bad, and what we could do better next time, doesn't pass the pub test, because ordinary Australians know a proper inquiry is the least they deserve, given they'll be paying for the impact of last year for a generation. Any decent inquiry would examine the state of our initial pandemic preparedness and the adequacy of the National Pandemic Plan. It would examine our national medicine stockpile, the initial surge capacity of our hospitals, ventilators, all of that, infection control procedures in our aged care facilities. It would look at the reliability of the World Health Organisation's advice, consider the criteria for closing our national borders or imposing quarantine on some or all travellers. It would look at the way each state implemented quarantine and ran quarantine hotels. Well, we've just had a recent review by Jane Halton. How did that review miss this lack of PPE in Perth and the Uber driving hotel security guards? A proper inquiry would look at our health and medical manufacturing capacity, our ability to make something as simple as masks as well as sophisticated medicines. How well do we scale all of that up, and what can we improve? A proper inquiry would examine the health advice and how faithfully it was followed in practice, especially over border closures and lockdowns, and whether the health consequences of COVID were weighed against other health issues, and the weighting that was given to health costs overall as opposed to economic costs. How is it, for example, we're told everything was done based on expert health advice when state by state there's been a huge disagreement between the experts? This virus might be less deadly than some, sure, but it infects rapidly. And what if the next virus infects like this one, but it's more deadly, something like an Ebola or something we haven't even seen before? How much work have we done learning the lessons? What about the impact of this pandemic on private business as opposed to all those who kept their jobs and some who got their pay increased in the public sector? A proper inquiry would consider the operation of the National Cabinet and to the extent to which its decisions were implemented or ignored, and the extent to which having the feds pick up the tab for the state's decision-making helped or hindered issues like borders, kids going back to school. Give Premiers McGowan and Palaszczuk's enthusiasm, given their enthusiasm for a federal takeover of quarantine, which I have to tell you, it's nothing about quarantine in the Constitution. It's all about shifting the cost of quarantine to the Commonwealth. A proper inquiry could also look at the efficacy of having the federal government in charge of airports, which they do, and ports, but the states in charge of passengers once they leave, which is how it works currently. Now, does that need to change? After all, that was one of the big issues with the Ruby Princess debacle, because once passengers disembarked, they were being looked after, or not in this case, by New South Wales Health. The point here would not be to lay blame, but to learn lessons. If the Prime Minister is worried that a National Royal Commission could turn into a political circus or perhaps jeopardise public confidence during this crisis, its hearings, of course, could be confidential, with only its report and its recommendations made public. Now, obviously, compared to most other countries, Australia's done well, really well. But that doesn't mean that we can be complacent or self-congratulatory. If we are to keep succeeding as a nation, we can't just tell ourselves we're the best and leave it at that, because clearly, as 800 families in Melbourne know only too well, mistakes were made that shouldn't have been made. No amount of amnesia from politicians will change that. And like a lot of things in this pandemic, a Royal Commission isn't an issue where the PM needs the Parliament to agree or his Premier mates to fall into line. A Royal Commission happens with the stroke of a pen. It's something the Prime Minister could establish tomorrow. And as time goes on, more and more Australians want to know why the delay.